Hello everyone. Welcome to Ikshana Wellness Talk. This is Dr. Satish, surgical oncologist, and Dr. Shiva Charan, medical oncologist. I have few questions regarding cancers. My first question is cancer increasing in India, and what has changed in the last 10-20 years?
Yes, definitely we are seeing an increasing the number of cancers, chiefly attributed to change in the lifestyles. When I say change in the lifestyle, it can be attributed to sedentary lifestyle, desk jobs more commonly, obesity because of change in the dietary habits, so also increase in environmental pollution, what we see, and probably partly better awareness too. What we see, obviously we are seeing more number of cancers that are being detected and coming down to the doctor's clinic.
Yes, that was a good point. I'd like to add a couple of points to that. So compared to previously, now our population is more, so that's why cancers are more. Secondly, people's awareness is more. We have more and more people talking about cancer. There's more information put out on social media about cancer. So it's getting picked up early. When they're able to go to any healthcare professional, not necessarily a doctor, they're able to suspect it is something and send them up the ladder for the referral to see if it is a cancer. So pickup is better, and also we are picking up things at an early stage. So they're going up the ladder to a higher center earlier rather than in the last stage. That's why we are seeing more and more cancers.
What is the most common cancer in India today in men and women?
So in women, the commonest cancer is breast cancer. Again, maybe 10 years ago, the cervix cancer was more common because we are more of a rural country. Now, with us becoming more modernized or westernized, we are having similar cancers to the west. Breast cancer is the commonest in women. In men, lung cancer is the commonest, followed by oral cancers. So we have a lot of other cancers like colon cancers, which are common to both as well. So mainly it's our habit of smoking, oral tobacco, pollution, all of which contributes to a lot of these oral cancers and lung cancers. Would you like to add anything?
Along with adding to the list, now we are seeing that there is an increase in number of gastrointestinal cancers too. The changes in the dietary pattern, as Dr. Satish sir was rightly mentioning, westernization of the diet that we see in India, probably that's also adding on to the toll of gastrointestinal cancers, which is slowly picking up. And also adding to the brunt, we have alcoholism that has also gone up more and more, adding to the gastrointestinal as well as hepatobiliary cancers.
Why is there an increase in cancer in the younger patients nowadays?
Yes, we are seeing a good number of cases. What earlier was thought to be that cancer occurs at the age of 60 plus. Now we are slowly seeing that patients in the age of 20s, 30s, 40s being diagnosed with very aggressive varieties of cancers. Probably the chief factors, as we had already discussed, one is change in the lifestyle, food habits, stress, the urge to meet their deadlines in their work and all the pattern. Probably altering the stress itself is one factor that will bring down the immunity, increase the something called as the oxidative stress in the body, which is one factor that is probably contributing to the cancer development or the formation of cancers in the body. Plus, adding to that, we have the changes in the dietary pattern, which is also adding to the brunt of the thing.
So, just to add a note to that, some of the cancers that we see in India occur 10 years younger than what they occur in the West. So we are seeing more cancers at early age than even the West. So definitely there's a lot of stress and our lifestyle which is playing a role in it. Apart from that, to add a small point, we do see some cancers in very young people in 20s, mid-20s or early 20s, which are not very common, but the numbers are increasing of late. Probably the immunity, the genetic strength of such patients are poor. Their ability to repair, to recover are also quite bad. So even though they are young and we try to treat them aggressively, their overall outcome is quite poor most often because the tumor tends to be more aggressive. This is what I'd like to add. So this is all that we are discussing about cancer in this episode. So thank you for talking to us and discussing about these aspects in cancer. Till next time, take care.